All this is Dr. Mobeen Sayyed from drbeen.com. Welcome to one more show. I think this is our fourth show today, and my apologies that since the morning we've been doing talks, and the last talk was started at 2 o'clock and it finished at 4 with Dr. Breen. And after that, I became so tired, I went to sleep. So I just woke up. So this is why it is a chit chat and not another topic. My apologies. So let's talk. So Christy says, we are spoiled with Dr. Bean. He's an excellent teacher. Thank you very much. Greetings to everyone. So my apologies that today, that initial small topic I would not do. Dr. Bean's interview, I missed it. Yes, so today actually two channels had interviewed me. One was in the morning, 10:30 to 11:30, I believe. That was about United States medical licensing examination. So some students wanted to talk with me. And then at 2 Pacific, there was another talk with Dr. Bream. He goes live, I believe, on medicine on YouTube and Facebook with the name Bream Medical. He is an emergency physician, and he has his own show, and he was kind of wanted to talk about the therapeutics for COVID. So that's what we did. We continued for about 2 hours. Great guy. I loved it. Christy says, saw the Facebook Dr. Bream discussion. It was good. Thank you very much. I saw many cool beans over there as well. So it is so funny that I can now recognize cool beans at the Bird Group or at FLCC or Dr. Bream and here. So thank you very much. So Doug, I had actually posted a link as well on YouTube. Carly says, yes, talk with Dr. Bream was great. So it was funny, Bream and Bean. I wonder if he'll end up in Facebook jail. His talks sounded like he would. Dia says, did anyone watch the Facebook show? Christy, so that was the problem. I actually, after the discussion, I went to sleep. It is, I was just woke up about 10 minutes ago by my family member saying, hey, don't you have a lecture? So here I am. So we have a talk now. Okay, so France, how are you? Christy Caroline says, I was afraid there wasn't going to be a discussion tonight. I know you've been very busy. Today was specially booked. You're very welcome. Okay, so let's see if there are any questions. Have you seen that? Hey, France, how are you? Yes, Luffy is specializing in catnip sciences. Yes, you're correct. Have you seen that that Israel is? So let me share my screen. Couple of things. One, good news that Israel, if I go to Worldometer, Israel had, I think, 30 cases or lesser. So see, nothing reported here. So on April 22nd, 315, but after that, there have been really, April 26 were, what was the number there? 80. I think yesterday there were only 30 cases, which is an excellent news. So Israel has really done well. So that is a good news. The concerning news was that they said So Israel, young men, uh, vaccine and heart issue. So Times of Israel. So this was sent to me by David as well, our cool bean, our own cool bean from Israel, who is here in San Jose. So Israel said probing link between Pfizer shot and heart problem in men under 30. So that is concerning. Just like Johnson and Johnson with women under 48, now here we have Pfizer and men. So what we saw was, what they have seen is this. They're saying, the report said that out of more than 5 million people vaccinated in Israel, there were 62 recorded cases of myocarditis in the days after the shot. It found that 56 of those cases came after the second shot, and most of the affected were men under 30. The report said that the 60 of the patients were treated and released from hospital in good condition. Two of the patients who were reportedly healthy until receiving the vaccination, including a 22-year-old woman and a 35-year-old man, died. So this is serious and this is not good. So that is the news. I am waiting a little more to understand what is going on, but this is similar to the clotting as well. In the case of clotting, for example, in the US, when the Johnson and Johnson was paused, it was given to 6.8 million people at that time, 6 clots, 1% dead, 1% in ICU. So it is a very similar number, not the total number, but the deaths are 5 million vaccinations. What I do not know is, out of those 5 million, how many vaccinations to under 30 years of age? Because that is what really would tell you the right percentage. So this is concerning. On the other hand, Israel is, I think they're done almost with the vaccination. India is not doing well, so that is an issue. And once again, I keep saying it, I keep repeating it for India. While even if, let's say, there was vaccine available today, one cannot just magically spread it out in the society very fast. Even if, let's say, other treatments were available. So the most important thing is to start social distancing and starting to reduce your activity and interaction, wearing masks. Then the second part is to look at the vitamins and ivermectin and hydroxy and zinc. And then the third part is going to be vaccinations and next things. So the initial pieces are actually easy to do. John Snyder says Brazil had 70,000 new cases today. So let's look at that. So if I go to Worldometer, Brazil. So Brazil is not doing well. Although the numbers are coming down now. So 76,000 in one day, moving average, and 56,000 moving average. If I remove the moving average, 26th, 29,000, and then 70,000, and so on. Their peak at this time had been about 97,000. So still they are coming down. The numbers are coming down. Active cases at 1.1 million. So this is, and of course the deaths are following. So Brazil is not doing good. How is India's numbers? So there was some hope that I thought that the newer numbers are coming down, although maybe that is just wishful thinking or too early. But if you see, the numbers were in 345, 349, and so on. Excuse me. And then 319,000. Still a very large number, but looks like it is coming down. Active cases stand at 2.8 million currently infected, so two times more. So Brazil is about 1 million. Here we have 3 million. And the deaths are following that number as well. So serious situation. How is US doing? $32 million total cases. So very slowly and gradually reducing. So 47,000. What is 7 days moving average? 58,000. So almost half of Brazil's daily. But compared to what US was like 255,000 in 1 day, just like India, but now they've come down, which is good. Active cases are, wow, it's 7 million active cases. And deaths are, again, good news is that this is all coming down. Doug is saying, which is it? So this is US. So Samina says, show for Bangladesh. Let's do that. Bangladesh. So daily new cases, they're coming down. There is definitely a spike, as you can see here. So 7,000 at the peak, and now about 3,000. So if I take the 7-day moving average, much better controlled, 7,000 to 3,000. So almost come down to half by, so this is April 10 and this is 17. So within 17 days, it dropped to half, which is good. Active cases, 76,000. Siri, Alexa, what is Bangladesh's population?
Bangladesh's population is 165 million people.
So that's a large population, and then having a smaller number of active cases is actually very impressive, 78,000, and these are coming down. So that is good. A number of deaths are following that as well. But generally for this population, the number of cases, number of deaths, they are less. So it looks good, although the spike was there. Okay, so let's see. Lenny says, could Israeli men under 30 have pushed activity and exercises and not rested after vaccine? Could that result in myocarditis? Maybe. So no one has yet provided the mechanism, although we know that if we just look at pure general mechanism, that is that sometimes viruses, I'm not talking about the vaccine here, sometimes viruses can actually cause muscle myocarditis. So let's say if this is, let's say this is heart, and then so the muscle of the heart can actually swell up by various viruses, and Coxsackie virus is being one of the more common one. So one, it is possible that the virus can do this, but in this case there is no virus, so possibly the inflammatory cytokines are the ones that are reacting, or maybe the antibodies that are reacting. So we got to now see, what is it? Is it the inflammation? Myocarditis means that the muscle of the heart is inflamed, not the other surfaces. So if I go here, looks like the inner surface is the endocardium. So that is hopefully okay, which is a good news. Otherwise it would cause clotting. And then the outer surface is okay as well. It is the middle muscle that is inflamed. And that can be serious as well. So it's not that it is okay to have that, but I think it is either the inflammatory cytokines, or most probably these are the antibodies that are cross reacting here, just like we saw antibodies cross reacting with the platelet factor 4. Chandra Sekhar Bara says, Dr. Bean, do we know which category of patients, certain blood groups, or certain specific illnesses or medical conditions, etc., who are requiring oxygen treatment? No, so the comorbidities that we have discussed previously about a year ago, that folks who have diabetes, especially uncontrolled diabetes, folks who have hypertension or cardiovascular diseases, folks who are obese, cancers, autoimmune diseases, such folks are at a higher, they are infected and they have severe situation. Now, having cytokine storm doesn't seem to be directly related to, for example, let's say obesity, but obesity itself can cause the immune system to tip over and can modulate the vitamin D and estrogen and many other things. I've done a complete discussion about this. So it is possible that some of these are actually the side effects of some comorbidity that then makes the person vulnerable to the virus. So this is a very good question. Svetlana says, where in Canada one can get ivermectin? I don't think that ivermectin is easily available in Canada. I think ivermectin is not there at all. KW says, I had a severe 7-day reaction to Moderna vaccine, fever, GI disturbance, body muscle pain, side of my face numb for 1 day. Should I get the second dose? So that is very tricky question, because 7-day reaction to Moderna vaccine and then hoping to get I can just tell you this, I cannot advise you to take it or not to take it, but I can tell you that usually antibody or inflammatory responses will be more severe or would be more after the second dose. So there is a possibility of the response as well that may be more, but I can't say that with certainty. So the best way to do this is to talk with the doctor to say, here is what happens. He knows your history. He knows if you are, what kind of health conditions or not you may have. For example, if you have no health condition and then this is happening, then the approach should be different, versus let's say you have some comorbidities and this is happening, then the approach is to be different. Fizan says, if someone has 40 to 60 oxygen with type 1 diabetes, obese, is there any chance of surviving and coping medically? So are you talking about, is this person COVID infected? Are they on ventilator 40 to 60? Because at this level, usually the person does not survive for long, unfortunately. Wow. M. Gregory says, I had myocarditis as a kid from rheumatic fever. That's so sad. So how are you doing? Are you on a chronic treatment with antibiotics? So Lily says, can you please tell me about the situation in Peru? So let's do that. If I go here and so 1.7 million. So Peru is not doing good. I cannot imagine. I had done a talk, although YouTube demonetized it, so it has kind of become a hidden thing now. I had done a talk about how Peru helped its population with ivermectin. I think this is that curve. And now all of a sudden, Peru is just going up and up. So it is not doing good. maybe if we can become a little optimistic and say it is type of contained or coming down, but that may be just me thinking wishfully. Um, Active cases are low, so that is good. 20,000. Death is following that as well. So Peru is not doing good. It needs better intervention. Lily, I'm sorry, Peru is not looking good. Um, so my stroke recovery, my body, my choice. Okay. Uh, uh, can neem leaf extract work in the same way as ivermectin as an antiviral? So I have heard this question a couple of times at neem leaf. Neem is for the cool beans here. Neem is a tree, and that there are some leaf. I remember that in our young age, when we used to get infected, our mother would say, "Let's bring neem leaf and crush them and then feed them." So we used to have they tasted bitter, so we used to have neem leaves all the time. So what I do not know is that if there is a connection with ivermectin or not. Somebody had asked me this question before as well. So maybe there is a relationship which I do not know. So I have to study this. My stroke, my recovery. Good question. It was on my mind as well. Jody says neem oil is good to use on your skin to kill COVID on contact. Oh wow, I didn't know that. Skyfrog says, I use neem oil on my garden. Wow. I thought it was just me who had been fed neem leaves by my mother. Fran says, you have his number. So some side discussion. Ijaz Wani says, how safe is it to get vaccinated if a person female is having idiopathic thrombocytopenic purpura? So for those vaccines that are adenovirus based, for example, AstraZeneca, Johnson and Johnson, Sputnik, and there may be more, some Chinese as well, which I do not remember off the top of my head. They tend to cause clotting as well. So of course, if somebody has ITP and then on top of this there is a risk of clotting with these vaccines as well, then they should not be taken. Other vaccines do have a chance for clotting as well, and that is where the doctor has to step in to decide that is the person have active ITP, are they taking medicine for that, and if they're taking medicine that may be protective from the vaccine. So Moderna, Pfizer type vaccine may actually be better choices, but with your doctor's advice. So Nancy says, wasn't Peru using IV? So I think that yes, Peru was using IV, and then what I heard was that it was stopped and the cases started going up. So Fighter Spirit says, Doctor, there are 3 people whom I know personally who have taken 2 doses of AstraZeneca and have died. What's happening? So I do not know what is the side effect they suffered from or what did the vaccine do. But we are seeing effects of vaccines. I'm sorry for this situation. So Trickfall says, Business Insider shared an article today showing fantastic effectiveness for one of either of the messenger RNA vaccine shots. Why can't we wait longer to have the second shot? And I think that may be possible. Taking the second shot may be good, but maybe waiting a little more may be nice as well, just like UK did. I remember when UK decided to spread out the 2 doses, they were all criticized by the world to say, and I criticized them as well, to say that the dose expansion or dilation of the time between the doses was not according to the trial results. So I maintain that that message, but the outcome was good. So it may be that we should also separate out the doses. Doug says, so I'm just going to quickly show this and then answer your question. I'm good. Doug says, don't nematode. So nematode. Very good, Doug. Question, did CDC say vaccinated people can be lax in mask wearing? Yes, they did. CDC is just, I think we have learned one thing, and that is that CDC is just not very scientific and medical oriented. Net worth associates. I hope this is just internet rumor, but I'm hearing women are experiencing erratic bleeding and miscarriages by just being around those who have been vaccinated. Please dispel this for us. It's just so, it is so difficult scientifically to prove that this can happen than to disprove that this would happen. I usually try that, it. If I hear some myth or rumor, I try to prove it that, okay, here are the mechanisms that may make it work, and then see if those mechanisms are possible. But just standing next to somebody who's vaccinated and getting a miscarriage is just not possible. There's no such mechanism. So Chandra Sekhar Bara says, Dr. Bean, what's the latest revision on COVID infection through surface contamination, especially plastic bags, tablet, tables, etc.? So fortunately, I have not been providing what CDC says because they continue to change it. I show them. So for us, it is just very simple. Here is how to think about the spread, other than the air spread. So we know that the air spread is made up of droplets, which are bigger particles. And as they pass through the air, they can become smaller as well. And so they can become aerosol and stay afloat for hours. So we know this part. On the surfaces part, I've done this discussion before, that the way to think about it is very simple. This virus, so let's say here is the SARS-CoV-2. This virus has a lipid membrane, and that means it has fluids in it, right? So it has fluids, and it needs to have those fluids maintained in it to stay viable. That means if it is put on any surface that is porous, it has pores. And I always give this example, let's say the kitchen towel. We use that and it has pores and it is porous and it can take the water, it can absorb it. So water absorbing surface, if it is put on those surfaces would quickly absorb the water and the virus would dry out and it would become like a microscopic crumpled thing, and it would become not valid anymore. So those surfaces that are porous, for example, cardboard surfaces, paper surfaces, other porous surfaces or bumpy surfaces, over there the virus may not survive as easily. Now those surfaces that are plain, for example, plastic surfaces, shiny surfaces, which have less pores, they would allow the virus to sit there and be viable for a longer period of time. 2. Third, those surfaces that are wet, because virus wants wet surface to stay valid. So those surfaces that are wet, or those environments that have moisture, over there the virus would stay longer as well. So that means you can actually think for yourself here to say, okay, here is a surface, let's say this table surface of mine, it is porous, it is wood, so it would have less virus. But imagine if the virus load, and I'm going to gross you out. So let's say somebody puts a big piece of snot here. And so now this is enough moist, plus it is enough bumped up that there are pieces of viruses that are going to just survive in it for a longer period of time. So that is a load of the virus in the fomite on the contaminated surface. Or similarly, whatever, spit or nasal secretion or eye secretions, or somebody who's went to the restroom and hands are dirty and they are placed. So at the end of the day, it is not about what surface is okay, what environment is okay. It is more about, can the virus stay valid? And virus would stay valid in moisture and wet surfaces. And that is what you have to check for. I hope that helps create some thinking foundation about it. Uh, Next question is De Magtoto. Dr. Bean, are the mechanisms of development of antibiotic bacterial resistance the same with the viral mutations to escape immunity from vaccine or natural? So in a bigger picture, you can say yes. In the smaller picture, you can say no. For example, in the bigger picture, saying yes simply means this. A bacteria, so let's say here is a bacteria, right? So this bacteria wants to survive antibiotics, correct? So many times what happens is that we make antibiotics that would go into the bacteria and cause destruction. They are like grenades that we throw in the bacteria. So what bacteria have done is that they've made pump, like uh, water pumps. Just like that, they have made enzymes that look like pump, and they would pick up the antibiotic and pump it out and throw it out. So as soon as you give the antibiotic, they are just pumping it out of themselves and they are surviving okay. So this is one way of developing resistance. Similarly, sometimes what they do is that if, for example, the antibiotic that you gave is going to go into the bacteria and bind with the enzyme. So let's say this is an enzyme of the bacteria. I'm just making up a random shape, so nothing interesting. So let's say this is an enzyme, and the vaccine, I keep saying vaccine, sorry, the antibiotic would come in, and let's say it would bind here to disrupt this. And so the antibiotic is now going to disrupt it. What bacteria can do in turn is it would change the shape of this area through mutation, and now the antibiotic cannot bind correctly in this area and is not going to function. So ideally what I meant to do was something like this. And so this antibiotic is not able to bind, and now bacteria has become resistant. So if you look at these mechanisms in the bigger picture, yes, the virus, when it is mutating, it is going to escape. And that is a antiviral or resistant behavior. But virus do not usually do these kind of things, the pumps and those things. So instead, for example, virus's resistance could be, here is a spike protein. And let's say this is the receptor binding domain. And we have made vaccines now against this part. And what would happen is that the virus would change this thing enough that antibody cannot bind to it. And now we have a resistance. Again, we have seen this, and I would say it with this. With the spike protein vaccines, that means AstraZeneca, that means Johnson & Johnson, Moderna, Pfizer, many other. The spike changes in the virus are, for example, in some cases, India, 13, which we say double mutant is actually 13 changes, which I had showed before. Similarly, in some cases, for example, I believe in the UK's case, 17, and so on. Compare that to the spike protein's own genome sequence, which has, so these are, I should not say proteins, amino acids. And I believe that the spike protein has many thousand amino acids. So let's say 7,000 amino acids. I'm making up a number. Now, 7,000 amino acids and 17 changed or 13 changed. So what? That percentage is very tiny. And that small percentage is not sufficient to say that the virus has escaped. Now, if you insisted that, hey, we have to figure out some way to make it escape, here is how it would happen. You would take a vaccine. So let's say here is the original spike protein. You brought in vaccine that would attach here. And a vaccine would produce antibodies that are hundreds of them. So I'm just using one, but imagine there are others attached everywhere. And I am looking at the receptor binding domain. What virus does is it makes a change in this area, and now this one antibody is not able to connect anymore. So efficacy is less. Then virus makes one more change on top of this change, and now there is one more change, and now antibody cannot bind further. More antibodies cannot bind. First A was not able to bind. Let's say there was a B antibody, that is now B cannot bind anymore. But you have to consider that during this time, the virus has to make sure that it can continue to bind with ACE2 receptor, so it can continue to infect the cells as well. So let's make ACE2 receptor here and make sure that, let's say, they both are fine. Good. This virus is okay. Now let's say this mutation occurred and they both are still fine. Some change, but it can still bind here. So, okay. Now to this one, it seems like it's not going to be able to bind with ACE2. So it has developed good resistance, but it is going to die because it cannot just work with the ACE2 at all. So this is a not viable virus anymore. So thinking that somehow vaccine escape will develop, where virus would develop so many changes that vaccines cannot do anything, but virus is still continuing to keep functionality intact to bind. How is this possible? That on one end we say that the binding site, my hand, imagine my hand is the binding site. Binding site is changing, the fingers are going away, and then we say it keeps working like a hand as well. That is not an easy thing to do. Yes, you can say, well, virus is going to decide here that it's not going to bind with ACE2. It has found a new receptor that now looks like its new shape, and it can now bind with that one. But how many such receptors do we have that virus can randomly select a new shape, and then the new shape is conforming to some receptor to which it can bind? So virus mutation have a limitation on them, that they have to let the virus stay viable as well. If there are mutations that they don't let it stay viable, then it could be drastic mutation, but it would be of no use. So if I look at your question once more, Mac Toto, to answer your question, in a bigger picture, can viruses develop resistance? Yes. Can bacteria develop resistance? Yes. So in general. Now, resistance to vaccines for SARS-CoV-2, can we make this kind of a resistance here? It is very difficult to develop this resistance. Francis, so Vax should come back with back scratcher instead of donut. I think so. So let's see more questions. Rio R. Question: does testosterone help coping with COVID? German researchers are revealing that boosting the testosterone to 3 times might help to fight against COVID. So I have to see the study, but generally, previously what we know is men are twice more infected than women, and they are more severely ill. They get more severely ill than women. So one thinking was that men have the testosterone more than women, and that was one of the contributors. There were more thinkings as well. For example, there was a thought in that study where they observed this. This was done in New York. They thought men are less clean compared to women. No offense to men, I'm a man as well. Men are less clean. They are less hygienically inclined. They go out more, and so on. So there was a bunch of behavioral differences as well that they thought may have been the contribution. But I have not read about testosterone. I'll have to look it up. Mia says, question: after 6 days of my dose, I used prescription NSAID, Fastum, gel, Ketoprofen, is it safe and won't interfere with vaccine since it was 6 days after the vaccination, even though it's prescription and said not OTC? And that is fine. Number one, the vaccine has already triggered a lot of immune mechanisms, and they are working and the cells will be forming. So yeah, not an issue. Charles says, and as known as Robin Hood, CDC equals comical double-blinded crew. That is very, very possible, yes. So France is saying that people reporting itchy skin, Dr. Bean, as a side effect. Yes, I can understand. So yes, back scratcher. So, so today we are talking about snorts and those things. I'll tell you a gross story. So when I was in Massachusetts, my kids were young. So Hamdan was, I think, 4 or 5, and Hassan was 8. And my manager and his family members, they came over to meet us, and we were all having fun and talking. And then Hamdan comes down from upstairs. I still can remember him. And so 4 or 5 years old child, and he had my back scratcher. And he brings it down with lots of pride and goes right to my manager's wife. Jennifer was her name. Goes to Jennifer and says, Jennifer, my father has this. And she was just totally, she didn't know how to react. And I still remember, and we make fun of Hamdan for what he did. Daniel says, is it normal for the coronavac to increase blood pressure shortly after the injection? Coronavac and the blood pressure? No, it will not. It should not. So this may be psychological. Again, I hate to put things in psychology bucket and then say that is what it is. But shortly after the vax, unless there is allergic reaction to something, which would have more effects, for example, most importantly, some skin rashes or the breathing issues, anaphylaxis like things. So this may be more psychological, more nervousness than a vaccine related effect. Maybe vaccine too, but then we would have to have a bunch of other things. How tachycardia can occur is if vaccine causes allergic reaction, which causes blood pressure to drop by blood vessel dilatation. Now the heart works faster to compensate for the dropping blood pressure, and that is what causes tachycardia. Nerlo says, if you had COVID and nothing has happened to make you immunocompromised, should you expect to have similar or better response next time exposed, or is there a chance of you having a more severe illness? So if the status quo, the virus is the same and the body is the same, then yeah, you should have this milder thing, because next time your body is going to take care of the virus within 24 to 48 hours. And this time frame, SARS-CoV-1, 2 to 3 years. SARS-CoV-2, we do not know the time frame. Now it is, I think, more than a year. So at least we know that about a year is sufficient. From the previous text, 2 to 3 years, this protection is possible. Fun says, question, we made antibody tests for my mom, 60 year, after 2 weeks of the symptoms. The result was IgG and IgM 4.56 micro per milliliter. Does this give her good, no need for vax, moderate or weak protection against COVID? So what I do not know is that what is their reaction level. This is not in the international units or so if it is in the international units, it's kind of on the lower side, but still on the, if it is international, if we normalize it, that it is international, then usually 0.8 and 1 is the cutoff, and above that is reactive and below that is not. But there are some kits that say below 6 is non-reactive. So it really has to be kit based. So you have to look at the result to see what did the kit say. Joveria Yusuf says, how common cold is related to COVID? So many topics can be discussed in this one question. Number one, there are about 20% of common cold events every year or occurring in people are by coronaviruses that are human coronaviruses. So they're not really COVID related, but they're coronavirus related. So that is one relationship. The other relationship is that we saw that, I think this morning, rhinovirus. Rhinovirus is the one that causes 40 to 60% of the common cold symptoms are caused by rhinovirus. And BBC had reported that people who have common cold, they have less COVID. Or actually, let me draw it for us. So what they did was, this is an in vitro study. That means it was in a dish, not in people. And what they did was they put some cells there. So let's say these are some cells. And then they put rhinovirus on them, and they put SARS-CoV-2. And they found out that the rhinovirus entered the cells, infected them, and blocked the SARS-CoV-2 from entering. So this is another interesting relationship to the common cold, that sometimes common cold can actually reduce the intensity of SARS-CoV-2. And then what they did was, if I got my, when I was reading it, then what they did was they added SARS-CoV-2 here 24 hours earlier without the rhinovirus, and allowed the SARS-CoV-2 to infect, and then they put the rhinovirus here, and even then the rhinovirus won. So that is another interesting relationship to the rhinovirus or common cold, one of the common cold viruses, that in the presence of that common cold virus, the SARS-CoV-2 may not actually thrive very well. So this is the second relationship. And the third relationship is that the coronavirus, SARS-CoV-2 itself, can cause common cold-like symptoms because it is a respiratory infection. That is third. Fourth relationship is that somebody who has common cold and may have SARS-CoV-2 as well may shed, because they're coughing more, they're sneezing more, they have runny nose, and so they may shed more and distribute the virus more. So I hope these were the kind of comments you wanted. It was a very open question, so I gave lots of open answers. So there is a question from Ruslana Borisenko. Good evening. What is the dose for ivermectin recommended for kids? So dose is still the same. Therapeutic dose 0.15 milligram per kilogram to 0.2 milligram per kilogram. Cannot be given to children lesser than 2 years of age, 2 years, and cannot be given to children lesser than 15 kilogram of weight. Cannot be given to pregnant women, cannot be given to lactating women. Having said that, nowadays, the recommendation from FLCC and other folks, doctors in India, for example, they have upped this dose and this dose to 0.4 milligram per kilogram. So they have doubled it. So in children, I would request that not to double it, maybe 0.3 milligram per kilogram. And secondly, please remember that this drug has been used a lot on children to deworm them. So it is tested on children. So I hope that answers that question. Because it is milligram per kilogram, you just have to measure it for child's weight. So Fun says the reference range is non-reactive, lesser than 1. So that's what I suspected. And greater than that is 1 is reactive. So it is reactive. So that means she has antibodies, she's producing them. My mom's antibody result is 4.56, which is fine. It is good enough. Yes, there are some people going to show 10, 11, 12. But here is the deal. It is not the antibody level present today. It is really that immune system has become trained to make antibodies, and it has made antibodies. That means it has also made memory cells. That means that when the actual infection would occur, and I hope that it would not occur, but just from a theoretical point of view. So let's say we have now memory cells. So these are B cells that are sleeping. So I make them sleep in a Zen-like state. Do you know why I make these hands? Because the B cells that are memory cells, they always are still sensing. So they're not really sleeping like we are sleeping. Their sleep means they go in an inactive state. They're not making antibodies anymore, but they continue to to sense for the antigen. So their IgD receptors are active, and inside they are active as well. So they are actually sensing and they are looking for it, but they're not making actively antibodies. If these cells, now, so let's say in your mother's case, there are some cells that are actively working, they are making antibodies, and this tells us that there are memory cells that have been formed. If she gets infected now or gets the second dose of the vaccine, I don't want to say infection, so let's say the second dose of the vaccine or another vaccine, then what would happen is these active cells would proliferate. They would become more in number. They would say, look, I was already working on this virus and there is more of it, so I'm going to increase in number, and they'll make more antibodies. So that is during the active time when they're making antibodies. If that time is gone, the body has went into a resting state, the B cells, and now the infection arrives. So let's say here is the infection. Then these B cells are going to open up their eyes and they're going to say, you know what, I know how to respond to this thing. And they know how to respond. And this response would start within 48 hours. And what are they going to do? They are going to make copies of themselves. That is proliferation. They're going to start making antibodies. And they are going to make a ton more antibodies than 4.5. So generally, this is fine. So there is a super chat, and that is Bonds Mama 1. Does HHS 45 CFR 46 W with Hippocratic Oath and Constitution protect from becoming human lab rat? Can ivermectin be demanded? Can C19 be found in blood draw instead of nasal scrap? Legal way to resist. Thank you. So, unfortunately, doctor can refuse the treatment. And when doctor refuses the treatment, you cannot demand it. We cannot demand it. It's not me sitting here as a doctor to say you cannot ask for it. We cannot demand it unless the cases, for example, in New York, they went to the court and they said, we have a right to have this and please order them to do it, and court ordered them. So from a Hippocratic Oath point of view, the doctor who's saying that I'm not going to give you ivermectin, he's also saying I'm protecting you. And the doctor who is giving you ivermectin is also saying I'm protecting you. The problem with the one who is not giving you ivermectin is the following. He's saying I'm protecting you because this is a placebo, this is a useless, or the dose I have to give is going to be toxic for your cells. What he does not want to realize, I'm sorry, I'm a little harsh in this one because I feel annoyed, is that ivermectin is a safe drug. So let's say if I am your patient, you are a doctor, and you don't believe in ivermectin, and I am asking for it, and now you're annoyed, and you're gonna make sure you don't give it to me. That just in behavior is wrong, one. And second, educate yourself. Maybe you've refused me, but before that, educate yourself to see what is the truth in there. And then if you find out that the side effects are really low, then using it, giving it a try is not bad. I mean, look at it. The times are such that people have, let's say, clotting, and people lift the pause. So 10 doctors lift that pause by saying the risk is lesser than the benefit. So it is okay. So they are actually saying it is fine. So this does not even have that kind of a risk, ivermectin. So I think it is really a tough thing. When we had this conference over the weekend, the same question was asked from Dr. Corey as well. And he said that, look, doctor has a right to do an off-label management, and nobody can take them to court for that, because if they are taken to the court, there is so much ivermectin related data that he said, I would show up as an expert witness, and I'll come and show the data. So I don't think that doctor is directly should be fearful, although there are doctors who are. I think it is more of an education point of view now. And some folks have this feeling that whatever I know is what I know, and who the hell is anybody else to tell me differently. So that is where the problem is. Now, your question, can COVID-19 be found in blood draw instead of nasal scrape? Legal ways to resist. So in severe patients where the tissues are breaking down and the barriers are breaking down and the viremia has occurred, then COVID-19 can be in the blood draw. But in healthy individuals, normally the body would not allow a lot of virus to spill into the blood. Most of that would be taken care of in the tissues like lung and throat. There would be some that would go in the blood, but not in a very large number. So if I read between the lines, if you're saying that, hey, instead of having tests made with the nasal scrapes, why not just do a blood draw? That would not work. Blood draw can tell you antibodies more easily than to say the virus is here. We'll have to have a lot of virus to have it in a drop of blood, and a lot of virus is really going to cause damage. Joveria says, is it possible to be COVID positive after vaccination if one was not positive before vaccination? I mean, does vaccine create antibodies which is detected in test and patients come out to be positive? Yes, so that is the point of the vaccination, that the vaccination should come back and say, I made antibodies for you. So when you do the antibody test, you should say positive. And that is a good thing. So Patricia Bruni says, my son and his family are going to the Bahamas in May. How is the Bahamas doing? He and his wife have the vaccine, but the children are small. Should he start ivermectin to travel? So I'll give you the answer in two ways. One, we look at how is Bahamas doing. So So infection is continuing, but at a very low rate. I would suspect their population is low as well. They are getting a little more of a tiny spike there. I'm not too concerned if he is going to take care of themselves, meaning social distancing and making sure that they do not get too much mixed in the crowd. Having said that, for the ivermectin, I'll answer you from Dr. Paul Merrick. Dr. Paul Merrick had his vaccine, and then he said, when I traveled, I still took ivermectin. I have had my Moderna 1 dose, and I still take my ivermectin. So I'm a proponent of ivermectin. I realize that at some point the need for ivermectin would go away when the person has developed protection. But to be sure, there is nothing bad in it. Colin Hamel says, what's the worst thing ivermectin could do, even if it didn't help against COVID? Kill any parasite you may not know about. Yes. So it is the parasites that are sending messages to CDCs and WHO to say, don't let ivermectin become more widespread or we are goners. So yes, that is one very rare side effects. Svetlana says, you missed my super chat question. Okay, so I'm going to have to go up and see where is the super chat question. The problem, I can't even. So Svetlana, can you put it back up? I swear it has killed parasites. That is Denise. I haven't seen Cher for some days. I saw her a few days ago, but not more recently. Denise, so okay. So Svetlana says, is there any additional risk for a 65-year-old male with bradycardia, very low pulse, high blood pressure that is controlled by telemistrar to do vaccine Pfizer? So I can't advise to a specific person. But in theory, if somebody is living with bradycardia and that is their normal, the question to answer is the following by their doctor. I cannot answer this. Is their body in a situation that if they took vaccine and let's say they developed GIT disturbance and they lost some fluid volume, would that bring the cardiovascular system down, blood pressure down, blood volume down, nutritional status down, oxygen levels down, which may hurt? So that is something I cannot answer because let's say the pulse is low. Is the perfusion okay? Pulse is low, but oxygenation is fine, nutrition is fine. When they eat food, they can handle that extra burden on the system, cardiovascular system, without developing tachycardia type things. If these are things fine, then that means their body is able to work in this low activity state of heart. But if they are not able to, then the doctor has to see that if the side effects occurred, how fast can they help? The help would be simple, and that is to provide um, fluids and keep the heart, with medicines up and working. But can they have that help, and can that be timely? Can that be sought? This should be programmed and planned with the doctor first. Rizobit says, Dr. Bean, have you ever noticed that in medical articles, they always preface that it is unknown, even if something has been studied for 60 years? Is this how they get funding? Yes. So, yes, in medicine, everything is unknown. I was reading. So, of course, what happened is that with this pandemic, many of the medical procedures and processes and red tapes and good things and bad things have become open to public with much more depth. And then folks like me have not helped because we have kind of revealed that, hey, here is a study which is opposing, and here is a study which is pro, and here is a decision made on a poor study. So common public has become very much aware of these kind of things. So I was reading an article in which the article writer was saying two doctors said, we do not know why this happens, but then in the next paragraphs they continued on to explain why this happens anyways. So he was a little irritated, but this is the standard structure. I think that not only it is something that provides funding, but in some cases it is actually the case that we don't know what happened, but we have a conjecture, we have a hypothesis, and that hypothesis is what is discussed. Then what happens is people continue to take those hypotheses, they research on that, they come back and they say, no, you need to make a change, and so on. And of course, money as well. Sumit, so Dr. Sumit, good day, doctor. Instead of 0.3 milligram per kilogram body weight, can we take, say, 0.15 on day 1 and 0.15 on day 3, so twice a week as prophylaxis? That should be fine. I would still say make it 0.2 because 0.15 is the lower end of the therapeutic dose and 0.2 is the upper end. And I think at this time, with the variants that are more contagious, it will be actually useful to have 0.2. So 1 day and 3, that is fine. So Brooklyn Muse, thank you very much for the super chat, says, will regular periods return? I received first dose of Moderna on 312, so this is 427, while on my cycle, second dose 49. It is now 427, and I haven't had my cycle for April. I have never had irregular periods. So again, this, let's say if the reason is the vaccine, because not having periods, there are more reasons too. But let's say if the reason is the vaccine, then think about how this would work. Here is the dose 1. And what we are looking to do from the vaccine, the hypothesis that I discussed yesterday, is to find the cytokines and inflammatory chemicals, right? So dose 1 is taken. About 5 days to 17 days is the time during which immune system will become ready and would start making antibodies. Antibodies. That means during this time when the antibodies are being formed, there is going to be inflammatory response as well. There is going to be a tiny bit of inflammatory response right away after the dose as well, and that is because of the irritation of the local cells and the local immune system, which is saying, what the heck, dude, what did you just do? So there is going to be some immediate reaction. That reaction can be big enough that the cytokines that are released from here, that this can become systemic as well, and people can develop myalgias and all those things. But usually short-lived, couple of days. So this may not be sufficient to go and dysregulate the immune periods. Now here, this inflammatory system, the antibodies that are being produced, they are going to stay produced, especially after the dose 2. So where is the dose 2 here? So this was 5 days, this is 17 days. So let's say dose 2 is somewhere about 28 days. The dose 2 is given here, which will cause what? These memory cells that were formed here are now going to be proliferating here because we irritated them with the second dose. And now they're going to start making antibodies, all of them. And the inflammation is going to become a little more. When this would happen, this would continue on in a standard healthy person. This would continue on for 2 to 3 months, then it would settle down. So my suspicion is that the irregularity would go on after, when it starts, it would go on for 2-3 months before it becomes regular again. So short answer to your question, that will they return? Yes. This is not a permanent damage in the system. It is just presence of inflammation or inflammatory cytokines. These would stay up like this for some time, and then they would go down. In some people, this would settle down within 1 cycle. In some, this might be 2 or 3 cycles. This was a very interesting comment. Bones Mama 1 says, back your videos into Odyssey and brand new tube. We are not allowed to hear other professionals anymore. They may remove your channel here just in case. That is very interesting. So I have been taking, so the videos that I have not taken down is the questions, these chit chats. I have left them all on YouTube. But any smaller topics that I've discussed, these are focused, I have taken them down. Do you feel that there is enough value in these chit chats as well that I should take them down as well? Now there are about 110 chit chats. Joveria says, how long it takes for antibodies presence after vaccination. So that is what I just drew over here. Various people would respond differently, but usually 2 to 3 months is when body would just keep making antibodies. The thing is this, when the body is making antibodies, it needs the antigen to be present to continue to make them. If the antigens are not present and body is just like crazy making antibodies, at some point it's going to switch itself off and say, you know what, enough, there is no more enemy. And just like in movies, you see that somebody has gone crazy and they're just fighting at the enemy, and they just keep fighting even when the enemy is destroyed, and they're still fighting, and somebody comes and stops them and says, okay, stop. So it is that way. The T regulatory cell's function is to stop the body, to say, okay, fine, enough, there is no more antigen, you can stop. And that happens within 2-3 months. So it can be in some people early and some people late. So I hope that answers this. So Ren Wei says, hi, Dr. Bean, is it safe or wise to take hydroxychloroquine and ivermectin at the same time for prevention? So very simple answer. First of all, hydroxychloroquine can cause arrhythmias. We know it. I have seen it in my patients. So one has to be very, very careful. You have to talk with your doctor. You have to get your EKG. You have to monitor. I usually prescribe, if there is a doctor who's listening, I usually give hydroxy once, and I monitor them for the whole day. I ask them to keep a tab on their blood pressure and on their heart and pulse, and so keep a tab on that. And I ask them to tell me, I give them the next dose, and I see if their eyes are fine, they're not developing blurry vision, because there can be retinal issues as well. And I have seen that as well. And then the third one is G6PD deficiency patients should not take hydroxychloroquine because they are at a risk for bleeding. So considering that the contraindications are taken care of, then giving these two together has no issues. I have used them together in my patients when I was transitioning from hydroxy to ivermectin. I had not yet developed enough confidence on ivermectin, but I had developed confidence on hydroxy. So there was a time in my own practice when I had gone from, let's say this way, that here is hydroxy I was using, and then I started using ivermectin, and there was a window of time when I was giving them both. Now, do we need both? Sure, any extra thing is useful, but side effects have to be made sure that you are aware of them. Okay, so thank you very much for the super chat. Kevin Brazda. Hey, Kevin, how are you? Dr. Bean, do you believe the virus situation will be under control by 2022? So in many countries, it will be under control within 2021. And I think that globally, it would be under control by 2022. What worries me is India, and not because there is something wrong with India, but the population is more, and how are they going to quickly get ahead of this? I think the easiest way is to ask people to just lock down, stay away for 2-3 weeks. That would bring down the cases like a rock. And then after that, figure out how do we now get back to work? Do we do ivermectins or do we do vaccines or so? But yes, I think that we would be out of this very soon. Amazing Philippine says, great discussion as always. Thanks, Dr. Bean. You're very welcome. Abdullah Musa says, me and my mom took AstraZeneca vaccine on Feb 17, okay, about 2.5 months ago. We've been called for a second shot next week. Do you think we should take it? And if we don't, will one dose be enough to keep us protected? I'm scared of the second dose. So I would take my second dose, Moderna. My second dose is on 5th May. So I would take it. And so the second dose, usually, especially in the case of clotting, what they saw was if clotting was occurring, it was primarily after the first dose. And if it didn't happen after the first dose, there were very few chances after the second dose. So generally, you are a little more protected from clotting-like issues, but you may have a little more of symptoms, for example, fever or myalgia or fatigue. So I would just give you advice from what the authorities are saying that, hey, you should take it, and what I will be doing, I would take it. So I think that it should be taken. And people who say that I'm sold to authorities, I don't like the authorities and their behaviors. So I'm not sold. They have not paid me. This is just me being a doctor and thinking for myself. Arun says, sorry, the question scrolled. Arun says, sir, we all need vitamin D, but there is a risk of the person is taking calcium channel blocker, antihypertensive drug. No, so the calcium channel blocker is not going to disrupt vitamin D's function, but vitamin D can increase the calcium levels. So what would have to do is talk with the doctor, and what they would do is when you correct your vitamin D levels, that would bring the calcium levels up as well to accommodate the vitamin D's level, which is now normal. With that calcium level, now the calcium channel blocker dose may need to be adjusted. So there is going to be a calibration and titration that needs to be done. So Juveria says how COVID-related medicine increases sugar level. I don't know. This is a very broad question. Which medicine? What is patient situation? Sometimes when people are under stress, their diabetes is triggered. So I have no idea which medicine are we talking about. Uh, Nerlo says, can the virus survive in ocean water? And if so, could you catch the virus by going into the water? So first, yes, it can survive in the water. Not ocean water though. The contaminated water where fecal matter from people have been collected. And this is how many of the cities have been testing their communities' overall health by seeing if the SARS-CoV-2 is present in the sewage water. Now, ocean water, I don't think would have enough SARS-CoV-2 for us to catch it and become sick. But I have not seen any studies around that as well. My opinion is no, the clean ocean water, not some sewage water, will be fine. But if somebody is at a beach and there are people who are next as well, and there is a jam-packed beach, and some of them may have had COVID, then they may have the SARS-CoV-2 on their anal area, or they may be shedding it with their secretions. So I cannot guarantee anything in that case, but ocean water should have a dilution, and there should not be SARS-CoV-2 there. Remdesivir injection. So Joveria, I don't think it is the diabetes is related to remdesivir. A person who is taking remdesivir means they may have an issue with the COVID, which is more than healthy or normal. So maybe mild or moderate to severe situation. In that situation, body generally cannot handle sugar well, and it does it intentionally to preserve sugar for important areas. So generally in viral infections and under stresses, our sugar levels increase. So it's not the drug, it is the disease. Skyfrog says, you would need very small hooks to catch COVID in the ocean. Yes, that is very, very correct, Skyfrog. I forgot about that. I should have talked about it. So thank you for adding value. So Frank Thrana says, why, Dr. Bean, will you take Moderna? In excess of the other vaccine, it gives erysipelas, as we see at one of the Norway biggest emergency center. Best regards, Frank Thrana, acting chief physician. Thank you, but I took Moderna as a first dose, and Moderna is my second dose. But thank you very much. I hope I stay safe. Lizzie says, which COVID antibody test is accurate? Lizzie, every test that is approved has to be accurate, at least with the US. So we can't say that there is an antibody test and that is not accurate if it is FDA approved. This is possible that somebody has a variant and there is some signal on the test that is missed, but if that is the case, that should also be known. So they all should be accurate. Abdullah Musa says, in UK, there has been one case of clots in the second shot of the AstraZeneca vaccine. Yellow card has been updated. Do you know anything about this? No, I do not. But I suspect that this could happen after the second as well, although the chances are really low. Again, as I was talking with Dr. Bream today, the reason I keep protesting about these vaccines and not being ready is, fine, the vaccine can cause this. What are we going to do about it? Because this is something for which we can do something. So the question is, fine, they updated the label to say now when you see this vaccine, now this is going to give you clots as well, we have found out. Then what? Did you tell the doctor what to do? That is what is important thing. So to answer your question, no, I did not see this. And then more importantly, the health authorities, they're just playing a weird game. Remember last week, they had said, CDC, that we are lifting the pause, and now we would come back this week and provide help for doctors for symptoms and those. So I'm actually waiting for that. that they would do it. So this is Shard one says, please find my question. Okay, so let's find your question. So we're going to go on a hunt for a question from this is Richard. Richard, sorry, I did not read it correctly. Okay, so this is Richard. Yeah, Luffy has started his chime song of his people. Very correct, France. Here comes Luffy, paw the like. Yes, absolutely. Now, this is Richard. Richard, can you put that question once more, please? France says, tonight's winner is Lazy Beans for most likes. Jacob says, so Richard, as I'm trying to look for your questions, there are other questions too. I'm answering them on the way. If I took Vax, how can I get a test to see what level of protection I have? I heard there are different kinds of antibody tests and some won't recognize vaccine, but only prior infections. So I'll tell you the reason, and then you have to figure out which test would be useful. At least I think in the US, we are fine with these tests. So here is what is happening. Let's say this is the virus, and this is the spike protein, and there are more of those spike proteins, correct? So here. Now, let's say there may be a test that has used this area, for example, let's say M protein, as a signal for the test, and this area as a signal for the test, and this area as a signal for the test. Now you have a vaccine, and vaccine is providing the spike protein that is here. So let's say this is the spike protein. Now the vaccine, for this test, vaccine is offering one signal here and the other signal here, but this signal on the M protein is missing. So this test is going to come back and say, I have two signals, not third, and it's going to kind of fail. So it really depends upon the test, that what is the signal, and that is what you'll have to unfortunately research, or just get a different brand of the test. You can also look at FDA's approved test kits, and these should be up to date. So let's see, here is a question with the Richard. So this is Richard. Marek recommends aspirin during illness, but why only 325 milligram QD? Hong et al. 2020 recommends Celebrex 200 milligram BID, which is better, safe to combine both. I would go with one. So it depends upon the age of the person, depends upon their comorbidity, and if they need to just take blood thinners in general, like in advanced age. And then if the age is not that advanced that they cannot take blood thinners as well. So I would take, if you feel that, hey, Celebrex is better, I would just take that and don't combine it with aspirin. Aspirin 325 milligram is pretty good dose though. My wife, when she was having issues with the headaches and after Johnson & Johnson, I was using aspirin as well. So I think that take one or the other. Is it safe to combine them? Yes, it is probably safe to combine them, but dose is what would matter, that how much thinning we end up causing. So Crypto Kling says, if you have blood clot history, which vaccine might be the best choice? So answer is actually, if the history is because of heparin-induced thrombocytopenia, HIT, then any adenovirus-based vaccine should not be taken. If the history is, for example, idiopathic thrombocytopenia or some other reason for the clotting, then I would prefer not to take adenovirus-based vaccines, for example, Johnson & Johnson, AstraZeneca, Sputnik, and lean towards Moderna and Pfizer. So again, as you can see, this is something that the doctor has to see and look at your history and figure out what is the propensity. But generally, this is the approach. Elizabeth says, hello, I take 325 milligram of buffered aspirin twice a day for years for migraine headache. I don't understand why people are afraid of aspirin. There can be issues as well, but thank you for adding. So let's answer a couple of more questions and then we stop. Algebra Bean says, question, are you the Algebra Bean from Chicago? So question, if antibodies are temporary, how is it that they were detected for 2+ years of COVID? Beautiful question. This is actually an algebra question. So let's answer this one. Thank you for asking this. I actually thought that this question will be asked. So let's say here is a B cell, and this B cell makes antibodies, right? So these are the antibodies. Antibodies that are formed are proteins. They're pieces of protein that are going to run around in our body, in our circulation, in the lymphatic system, interstitial tissue, all over the body. They cannot enter the brain, but they would work in the rest of the body. Now, these antibodies will break down usually anywhere from 3 to 6 weeks, or sometimes a little more or less. So they have an age. All of our proteins that we produce, we break them down as well. Our body's rule is make something, break it down, make new, break it down, make new, break it down. So that's what would happen here. So now your question that, hey, if these things are temporary, then how do we have them after 2 years? Answer is very simple. These cells continue to make them for this much time. So it is the memory cells and some active cells. So some of these cells can actually continue to make baseline antibodies. So that means you can put the cells in 3 categories. Active cells today after the infection. So it is an active cell, it is making antibodies. The cell is going to be destroyed at some point once its function is done. Then another cell that would continue to work for months and years at a very baseline level. And then a memory cell that is kind of just sitting and waiting for the actual antigen to come. And if the antigen arrives, then it is going to spread, proliferate, and then make antibodies, which are going to be a lot. So the antibodies that people measured, one possibility is this. The second possibility is that, let's say they got reinfected and their B cells threw a tantrum and said, how you got reinfected? I'm going to make lots of antibodies, and they have antibodies. So antibodies could be made. And various infection, interestingly, various infection trigger our immune system in various ways that sometimes antibodies continue to be made for a decade, sometimes for weeks, and sometimes for years. So let's do one more question, and then we stop for today. So Kevin Brazda says, where is my Ivermectin t-shirt, Dr. Cool Bean? What happened? Did you buy it and it didn't arrive? So you know that the t-shirts are all with Teespring. I have nothing to do with it other than having the design. So if you didn't get it, please tell me and I would ask them. But I have just put them on Teespring and done. So my apologies if you haven't received them yet, but they should arrive. You should be able to look at them. So Abdullah Musa says, question, one doctor saying IVIG is a treatment for those clots with AstraZeneca vaccine. Is this true, and how an IVIG treat this problem? So yes, IVIG is actually, it's an immunoglobulin that can block other antibodies. So because there are antibodies, IVIG can help. That is one. But then there is anti-clot as well, the blood thinners as well that are needed, not just the IVIG. IVIG is an important part. But what would happen is, I did a talk about that, doctors would give injectable Drbeen. They'll move the patient to ICU and then manage them there. Or if the patient is discharged, then they would be on oral apixaban or rivaroxaban or something like that. Usually, heparin is not used. So with this, how about we, Stephanie says, what ivermectin side effects? Stephanie, is that a question to me? Ivermectin, 3.5 billion doses given, not many side effects. I think in this whole time frame, very few deaths, if at all, related to ivermectin. Couple of cases for the hepatitis. So that Sky Native, that is a problem. How can I get ivermectin from my doctor who won't prescribe for preventing COVID-19? This is the weirdest thing. I do not know what is up with the doctors. If somebody can be protected by giving a drug that does not even have a lots of it doesn't, for common majority of people, it doesn't have side effects. And so they can do off-label. You can ask them to do it. Some doctors become offended with that and they won't do it. So thank you very much for being with me today. It was a long discussion, but thank you for hanging out. I was with Dr. Bream today and I knew what would it take to take 2 hours long discussion. So thank you very much for your time. Please like, subscribe, and share. I think like is even better if you don't want to subscribe. And then in addition to that, if you would like to support this work, there are 3 links in the description. One is to buy me coffees. Today, there was a, just like Eric Hogg usually have very fun coffee messages. Today, there was a neuropsychiatrist as well who said, are you going to continue to take all these coffees? It's bad for you. So if you wanted to buy me a coffee, you can do that. You can also become a patron, or you can support this channel in general as well. Thank you very much, and I would see you tomorrow morning. Bye-bye for now.